Irritable bowel syndrome, also known as spastic or nervous colitis, is one of the most common intestinal pathologies that affects approximately 10% of the population, with a higher prevalence in women, particularly in the age group between 20 and 50 years. Irritable bowel syndrome, as the name suggests, affects that part of the large intestine called the colon. It represents the terminal tract of the digestive system and performs important functions, including absorbing water and electrolytes from the intestinal contents, but also some specific substances and vitamins produced by the local bacterial flora. In addition, it is also responsible for accumulating indigestible food waste and providing for its evacuation outside the body. Irritable bowel syndrome is a debilitating disease that prevents those affected from having regular intestinal activity, significantly worsening their quality of life. This syndrome manifests itself with a series of very specific signs and symptoms. But what are they? Let's go see them. Abdominal bloating. Abdominal bloating is a disorder caused by an excessive accumulation of gas in the stomach and intestines following the ingestion of air when swallowing food and drinks, or due to the fermentation of some foods by bacteria that live in the gastrointestinal tract. Abdominal bloating is described as one of the most annoying symptoms of irritable bowel syndrome and is more common in perimenopausal women and in patients with intermittent changes in stool frequency compared to those with diarrhea or constipation. Those who suffer from it feel an annoying sensation of having a belly swollen like a balloon, and it is often accompanied by abdominal distension. That is an increase in the volume of the abdominal circumference. A study conducted by some Korean researchers has shown that in patients in whom abdominal bloating is the main symptom of irritable bowel syndrome, the increased gas production is due to intestinal bacterial overgrowth. This clinical condition, indicated by the acronym SIBO, is characterized by an increase in the concentration of bacteria, especially anaerobic bacteria, in the lumen of the small intestine. This causes a quantitative and qualitative variation of the bacterial flora in the duodenum, jejunum, and ileum, the severity of whose symptoms depends on the extent of the contamination, the bacterial species present, and the extension of the intestinal tract affected. Abdominal pain. Abdominal pain is another of the most common symptoms of irritable bowel syndrome, and manifests itself with the onset of a painful sensation in the region delimited above by the chest and below by the groin. It is usually located in the lower part of the abdomen, especially in the umbilical area, and can be continuous or cramp-like. It usually tends to worsen after meals and improve after evacuation. Normally, the walls of the intestines, which are lined with layers of muscle, contract to help food move through the digestive tract. However, with irritable bowel syndrome, abnormal muscle contractions can occur that can speed up or slow down the passage of stool. Not only that, the onset of these spasms stimulates pain receptors in the intestinal walls, sending a series of signals to the central nervous system. There is in fact a deep connection between the brain and the intestine, which communicate with each other through a specific bidirectional nervous axis, responsible for regulating intestinal functions and emotional responses, thus influencing both physical and mental well-being. Brain imaging studies have shown that in patients suffering from irritable bowel syndrome, the neural processing of visceral stimuli is altered, and this may depend on the way in which the intestinal nerves communicate with the brain, or on how certain brain areas process this information. Bowel changes. Intestinal activity is a condition of balance between the various processes that regulate digestion, nutrient absorption, and elimination of food waste. In the case of irritable bowel syndrome, this balance can be compromised, negatively affecting the health and functioning of the gastrointestinal tract. The alteration of intestinal transit is linked to an increase or reduction in intestinal motility, that is, the ability of the intestine to move food along the gastrointestinal tract. This irregularity in bowel function is called alveus alteration and cause a change in the frequency of bowel movements or a change in the shape and consistency of the stool. This is because the residence time of the feces in the intestine is changed, which will thus take on a consistency that varies from soft and watery to hard and dry. Irritable bowel syndrome is therefore classified into 3 subtypes or variants. The first is characterized by constipation, the second by diarrhea, while the third involves an alternation of both disorders. The onset of one variant rather than another depends on a series of individual factors, including the sensitivity of the intestinal tract and the interaction with the nervous system, but also on diet, lifestyle, level of physical activity, and stress. Other symptoms. Irritable bowel syndrome can also manifest itself with a series of extra-intestinal signs and symptoms, that is, symptoms that affect other areas of the body and are therefore not directly linked to digestive function. Among these, we find a feeling of chronic tiredness and persistent fatigue, but also nausea, migraines, difficulty concentrating, and joint pain. This is because chronic intestinal inflammation can lead to systemic inflammation, in which there is an increase in the production of inflammatory cytokines and other molecules, which are not limited to the intestine, but can also affect other organs and tissues. For this reason, in fact, when gastrointestinal symptoms worsen, the joints, for example, tend to be more painful and swollen. The risk of suffering from migraines and lower back pain increases. Other extra-intestinal disorders present in irritable bowel syndrome include recurrent cystitis, pelvic floor dysfunction, fecal incontinence, and urination disorders, including the onset of a frequent urge to urinate or a sensation of incomplete bladder emptying. New research from the University of Missouri School of Medicine has also highlighted the existence of a link between irritable bowel syndrome and mental health. The results suggest that those who suffer from this intestinal disease have a higher risk of suffering from anxiety and depression compared to healthy subjects. One of the possible explanations lies precisely in the functioning of the so-called gut-brain axis, where its dysfunction can alter the communication between the two organs and favor the onset of psychopathological symptoms. In conclusion, we have seen how irritable bowel syndrome is a complex and multifactorial disease that not only affects the gastrointestinal tract, but also extends to other organs and systems. Symptoms generally appear in alternating phases, characterized by periods in which the disorders seem to improve, leading to temporary moments of relief, followed by episodes in which the symptoms intensify. They can last a few days, but also a few weeks, and the frequency with which they alternate varies from person to person, thus making the disease unpredictable and difficult to manage. In fact, it can have a strong impact on the quality of life of patients who suffer from it, and in some cases, the symptoms can even become disabling. Fortunately, there are some strategies, which although not definitive, in most cases have proven to be particularly effective in keeping irritable bowel syndrome under control. In a future video, which you will find by clicking here above, we will look at them in more detail.